Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of clinical practice. Let's talk today about nausea, vomiting, and pregnancy. I'm sure everybody's familiar. In the first trimester of pregnancy, you can have significant nausea. It can be quite difficult to cope with, and hopefully I'll give you a few tips that'll help you out. One thing you should know is even though it's quite unpleasant, there are some studies that suggest that there is a lower risk of birth defects and a lower chance of miscarriage in women who have nausea and vomiting in the first trimester. Doesn't mean anything's wrong if you don't have nausea and vomiting, but there's a little higher correlation of appropriate hormone levels if you do have some nausea. There are many remedies that you can search for. Here's a few that I find some helpful. So diphenhydramine, which is Benadryl, the over-the-counter allergy medicine, is one of the few medicines proven safe in pregnancy and proven safe, not just okay to take, but proven okay to take. And it can make you a little sleepy and tired, which is what you'll already have in the first trimester, but it can help with nausea. Unisom is another sleeping pill that helps with nausea, and that's doxylamine is the main ingredient of that. And there are some prescription strength versions of those medicines, but we'll get into the prescriptions in a moment. It's important to make sure that you keep some food down and some liquids. Of course, this is the problem, so it's easier to keep liquids down than solids. And one trick that helps is, especially if you have been throwing up, you need to replace the electrolytes, kind of like when you're sweating after a sporting event. That's what you're losing, those electrolytes when you're throwing up. So Gatorade in one of those metal containers with a little straw and some ice is a good way to sip a little bit of it. You'll find that a lot of nausea comes from smell. So if you plug your nose while you're sipping, take a little sip, wait a few 10, 20, 30 seconds, and then that has stayed down. And so little small meals throughout the day can help. Ginger ale, ginger root seems to be something that can help. And well, how do you know if you are getting enough in? Well, early on, it's not so much about how much food you have, it's about dehydration. We don't want you to be getting dehydrated. You can get dizzy, you can pass out, you can really get in trouble. So how do you know? Well, your lips are dry, your tongue is dry, and look at your urine when you go to the bathroom. If it's concentrated dark yellow, like it is normally when you wake up, that means you're starting to get dehydrated. Or if you're not going at all, and if these remedies that we're talking about don't work, then that's when it's time to get help, to talk to your providers. You might need to go in and get some medicines that can only be provided by a physician, or you might need some IV therapy. Some of the prescriptions that you might get are Zofran, Ondansetron, or Diclegis or Bongesta. Those are longer acting versions of the ingredient in Unisom with vitamin B6 as well. So Unisom and vitamin B6 are one of the over-the-counter remedies that you can try yourself. So hopefully these measures can help you avoid needing the higher level interventions with your healthcare team. But if they're not working, that's when you need to contact them and get the rehydration that you need to keep going in your pregnancy. I hope you found this helpful, and please leave comments. Thank you.